to another special edition of JMC Live Interviews. Today we're going to be interviewing the Hope Clinic. We have Dr. Jennifer Allen, who is a board member and is the quality assurance for Hope Clinic, and her husband Alan Davis. He's the treasurer and a board member as well. I want you guys to stay focused on this show today because you're going to learn about the history of the church, specifically when it comes to medical missions, how the hospital was created, and more specifically right here in Ross County, Chillicothe, Ohio, churches, the community, businesses, and even the medical community have all decided to work together to give our community a free clinic. Stay tuned. I'd like to welcome you both here. I know this is a wonderful day of 80 to 90 degree weather. You'd probably like to be out golfing, and you'd probably like to be outside, just enjoying yourselves. I'd like to thank you guys for coming today.
Thank you. Appreciate the opportunity.
Yeah, thank you very much.
You're welcome.
Good to see you again.
Yeah, this is their wonderful, I call studio home we're actually at. We're in an interview on site for a change, which I thought change of pace would be quite interesting. Now, Hope Clinic of Ross County. I know it hasn't been around very long, and there are a lot of people that are still trying to find out what it is about. So I'm kind of curious, can you tell our listeners, how did this idea of a Hope Clinic, a free service for medical assistance for people in Ross County, come about?
Well, the Hope Clinic, actually we started just about a year ago this time, discussion about it. And there were three people that were very vital to the organization and getting it started. Dr. Kevin Doherty, who was at that time the medical director of the Adena Emergency Room, had started other clinics throughout Ohio. And Jamie Easterday and Lana Urich from Brookside Church, both nurses, were very interested in starting some kind of medical mission organization. And they had a meeting together, and it kind of grew from there. There have been people in the past who have felt the call and the need for this service in the community. However, there were so many roadblocks, and it just never happened. And I'm thoroughly convinced that this time, with these three people who put God first in their life every day, who came with the idea of serving people in His name, to spread His joy and His love and His caring, we're able to then God was able to remove the obstacles that we'd faced in the past. So it grew from there. We actually started meeting, a few of us, about the 1st of April last year. They had their first meetings in January and February. And so it really grew from a love of God. And with His mercies and His support, we've gotten this far to where the Hope Clinic opened on January 16th. And if I'd just like to read our mission, because we are a medical ministry. We are a faith-based medical ministry, and our mission is to provide the love of Christ by providing basic, sound, quality medical care at no cost to those who have no medical insurance in a climate that is accepting, authentic, and inviting for people.
So how did you guys find out that this idea was coming about? Where was the dialogue to bring this to light? How did that happen?
Well, I had been a pediatrician for a long time, and I had retired, and I was searching for something else to do. At the same time, our pastor, Kurt King, had delivered a message and talked about God calls us to reassignments sometimes. We don't know why. We don't know why that happens, but He does. And so I thought to myself, it's time for me to get out and to try to do something else. And that very week at cardiac rehab, my nurse was Jamie Easterday, who was very involved with this and began talking about the project. Then later that week, Dr. David Smith called, a fellow physician here in Chillicothe who I very much respect and is a good friend. And he asked if I would like to be involved and if Alan, my husband, would also like to be involved. Alan had been in healthcare finance all of his career. And so we talked about it, and we thought it would be a great opportunity for us to be able to work on something together. And yes, we'd be spending time, but we'd be spending time on a project that we were both interested in.
Yeah, from my perspective, once Jennifer was the first to hear about it, and once she told me, then I thought this was a good opportunity. Like she said, I have 30 plus years of experience in healthcare finance, so a lot of times medical providers and those others involved don't necessarily have the highest level of skills in strategic planning, budgeting, and those kinds of things, and so I thought it was a perfect match. Now, Jennifer mentioned that she was looking for a reassignment. Well, a lot of people in this area know her because of her past pediatric work, but also know her because of the heart transplant that she had. And that was an extremely moving and experience for us, and one that then challenged us in our thought process, challenged us to say, God's been good to us. He obviously has a plan for us. What is it? And so whether this is the final plan for, that he had for us, but we certainly see this as part of that plan for why he interacted in Jennifer's life and in mine as we went through her heart transplant issues.
I know that was a very difficult time for anyone to go through, but pretty eye-opening. God gives you another heart so then you can have a heart for someone else. It kind of just ties in together. It's just something that not many people see. Now, with the Hope Clinic, the amazing thing that people have ran into that I've talked to about this, how can this be free? And what services do you have? And that's the biggest key factor everyone's been asking me lately, is what do you offer and how is this free? How did all this happen?
Well, it's free because no one is paid. There's not one person that's involved with Hope Clinic that receives payment of any kind. That includes the providers, the registration techs, the lab people. No one is paid. That doesn't, however, mean that there's no cost to running the clinic. And when we first asked for funds from different organizations, they said, well, we thought everything was going to be free. Yes, it is free to the patient. It's not free to us. We have to have medical records. We have to have a computer system. There were many costs that were involved in getting the clinic started. But the people, the volunteers, provide everything for free. And we are a clinic that we see people on a first-come basis. We're open from 6 to 8 p.m. However, at about 5:15, we start giving out patient numbers. And you're seen on a first-come, first-served basis. We cannot provide emergency services. If you have an emergency, you need to dial 911 or go to the nearest emergency room. We have no on-site radiology. We have some CLIA wave lab test on site, and we do not want to replace primary care physician or disrupt a medical home that a patient has. But we know in this economy especially, there are many people who are kind of left in the gap, and they don't have insurance and they don't have a place to go for care. They end up going to the emergency room, which is the most expensive medical care that's available. And it just becomes a snowball with them not being able to pay for the medical visits, not being able to pay for their medications, and they end up ignoring their medical problems because of this. And so it's been demonstrated for many years in many community needs assessments that this service was needed. So that's why we got started, and those are the things we do. If you think of an urgent care center, aside from fractures and those kinds of things, those would be the type of things that we would take care of. Colds, respiratory illnesses, gastroenteritis, things like that, which are acute illnesses. We also want to be able to help those people who have chronic illnesses, such as hypertension, such as diabetes, those who have found themselves without a way to get medical care and the medications that they need. We want to fill that gap for 3 to 6 months until something comes along to help them be able to get the care they need.
I'd just add the following on the question of how can we do it for free. And some of this, we almost see God incidences in this, or God's help in it. The health department had a great clinic space that they were no longer using. So we don't have to pay rent for space. We didn't have to build a facility. It's all there. They had certain equipment that they're allowing us to use. So that part is no cost to us, and we don't have to pass that on to a patient. We've also had organizations that traditionally provide services, like Adena Health System, that have stepped up and said, we believe in what you're doing, so we're going to help assist that by making available a certain amount of radiology testing and things like that. There was an organization in town that had the ability to help with prescription costs. Kroger's is allowing us to access their discounted prescription program. And then the third way, so we have other community organizations stepping forward and helping make this free to the patient. And then the third way is we've had outstanding support from individuals and organizations to say, we believe in this, we're willing to put some money towards it. And we have met our fundraising goal in a little less than the year that we thought we needed to do it. And and it's because board members have contributed, community members. We've had great support from churches, and then also organizations like AEP that donated $20,000, Junior Civic League, Meade Massey,
David Meade
Massey Foundation contributed, the Schaefer Foundation. So there's other organizations, United Way. So there's organizations that said, hey, we understand how important this could be for our community. So by them contributing, that takes some of the burden off on how would we do it otherwise, for free.
And I think one of the important things is that all of this money has been local money. We've not asked for government aid. We've not had to. It's all been from private foundations, businesses, organizations, and it's just been so heartwarming to have this money come from the community and have them really believe in us. And I think another way you can show the belief in our organization is the number of volunteers that we've had that have volunteered, have gone through the orientation, first filled out the application online and gone through our complete orientation, and are now working at the clinic. And we have over 200 of those that have done the whole process. We've probably had 400 people show some interest, but just haven't completed the process of application, background checks, and orientation.
So can you talk a little bit about the training you go through? I know there's the online process and then orientation.
We have an online application, and then everyone is required to go to an orientation session, which is a session that usually is from 5 to 9 or 10 o'clock in the evening. And everyone hears all of the orientation. We have a medical orientation. There are many things involved in a medical clinic. We have to follow the same HIPAA rules or privacy rules for patients that any other medical clinic, or we have to follow universal precautions. So we really do have to orient all of our volunteers about those special medical things that are involved with a medical clinic. We also have a spiritual orientation, and everybody is exposed to what our mission is and some ideas of how you can share your testimony. You can help somebody along the way, wherever they are on their path. You can be an asset to them. And so those are things that the volunteers have to go through. And the orientation is done by the people, the board, members of the board, and volunteers, the lead volunteers, and leadership roles.
Now, I know from the spiritual aspect, when I've been involved with the different ministries and mission trips with the medical missions that I've seen, being able to share your testimony, being able to have that emotional connection to somebody is not something you normally see in a regular medical practice, and I think it's a missing piece of the link, because I know depending on where you work, you're told to just separate yourself. If you get emotional, you need to go somewhere off in the corner and cry or whatnot. But where this is different, you can still have that connection, whereas, if somebody doesn't want to hear about Jesus, you can still show the love of Jesus to them. You can still be there and hold their hand and cry with them if there's something that's going on with them really bad. If it's their kid is sick or they're sick themselves or something, and you can talk with them. You can have that dialogue. And I'm very much aware that people have accepted the prayer, are having that dialogue. And hasn't somebody gotten saved at one of the clinic sessions?
Yeah, probably to start, just this in some ways is a spiritual experience for those who volunteer, as much, if not more so, than the patients. Yeah. So that is part of the training. And every session before the clinic actually opens, we get together and we'll have prayer as a group. And it helps us focus what the real purpose is, and that's to share the love of Jesus and God with others through medical care. So that whole aspect is there. And then once a person comes into the clinic, it's separated into two components. The medical is totally separate from the spiritual. They're given the opportunity to participate in the spiritual if they choose to, or if it's meaningful. And a matter of fact, the opportunity is there for someone even if they don't need the medical at that point in time. But we try to separate it to some degree so that it's not an imposition, but it's certainly available.
Yeah, when they fill out the registration packet, they're asked, would you like to see a member of the prayer team? And they can answer yes or no to that. And I would say probably about 30% say yes, they want to see the prayer team. And then after their visit, they will go to another area where there is a team that's assembled for the night with the lead pastor there to help them, to listen to their concerns, to pray with them. We do separate it that way, but I would say that none of them are going to be totally separate from it, because each and every individual that they meet at the clinic is spiritually, has a relationship with Christ. And so I think just in and of our actions, they will be experienced with it. And the doctors that are there, if they feel that it's appropriate, do not hesitate to pray with the patients at the end or at the beginning of the visit. Certainly not without their permission. And certainly it is not a requirement that someone be a believer in order to come to the Hope Clinic. The other thing that we do besides the prayer part of it is the social service side of it. So they're also asked, would you like to see a social service worker and participate in an Ohio Benefits questionnaire, Ohio Benefits Bank, to let them know if maybe they do qualify for some help from the state that they're not aware of. So there are all those pieces going on at the clinic.
Now, I realize some of our listeners may not know the history of how the church was the forerunner here in America and across the world with starting churches, but also specifically with hospitals and the nursing program and the medical community was originated by Christians. Here in the 1800s and 1900s, missionaries came to the United States, and current people living here wanted to start a program to reach the sick. There were a lot of plagues and diseases and things going on, and there was just nothing really to be offered for it much. The regular medical community was only to do so much, and the same situation we face today, people couldn't afford something. So the church stood up and said, we're going to offer this. We're going to offer it for free. Yes, it probably got funded in the background, just like it is here, and we were able to reach the community better, because that's what this is really about. It's about being able to love people and serve people and fulfill a role that a government agency or just a regular business shouldn't have to do, because the church and being a Christian is about taking care of one another. A big phrase that I've heard before is going to a church should be like going to a hospital. And honestly, the word church and hospital are pretty much a synonym in itself, because the origins of the church and the origins of the hospital are all about taking care of people. And the church originatedly started taking care and creating hospitals and medical missions here currently. People like World Vision and Compassion International and other missionaries, including some here locally that go to Adena and elsewhere, go overseas and go all across the country doing mission work to offer their services. You hear about this with children and adults, and what is an amazing thing now is all across the United States, we are seeing more clinics working together, or just starting up from the ground up, and seeing a change of churches working with one another, and even further goals than that is seeing the love of Christ being expressed when it doesn't even matter if they're saved or not. We're having organizations and businesses working hand in hand, all in the goal of wanting to try and help people provide a service so that their lives can be better provided, so they can live and have that quality of life they so deserve.
Well, I think there are two things I'd like to mention after you have talked a little bit about the relationship between the church and hospitals and missions. Dr. Kevin Doherty was a physician who went on many medical missions, and he was on a medical mission, and he realized that with his backpack full of the medical equipment that he could really put it in a backpack and minister to people, and minister to many people in different countries. And it struck him, why can't I do this at home? I don't really need a lot to be able to help people. And that is what, how his interest in starting clinics here began. He was on a mission, an international mission at that time. And so this clinic really has grown out of that kind of medical mission. Also, I'm sure that many people are aware that our hospital was started by the churches in Chillicothe, and the board at the hospital is still made up of founding churches, representatives. 9 of the 15 board members are representatives of the founding churches. So there is, especially here in Ross County, a strong connection between healthcare and the church.
So if people want to find out more information about the Hope Clinic, how would they contact you?
They can contact us through the website, which is www.hopeclinicfree.org. There's a lot of information there, and I know that we've forgotten to mention someone who's been people who have been very important in our organization, but we have tried to list there all the churches that have become partnership churches, and these churches have committed $750 or more a year to sponsor Hope Clinic. We have other churches that have given and supported us with prayers and with financial support, and individuals, and those are listed on the website. Also, when Alan mentioned that we have an organization here in town that was helping with prescriptions, that organization is Community Action, and they had a grant for prescription medicines, and they are using that grant to help pay for the medicines that people cannot pay for themselves for the clinic. And as we met with Community Action, Ms. Payne shared with us that other community action from different counties, as they met, they were amazed that there was this kind of cooperation between the social services in our county, because it's not a given. It doesn't happen everywhere. And the relationships that are developing and the cooperation that is developing among the churches. Several of the pastors that have been here, tenured, I like to say, like me, 20 to 30 years, have said they've never seen this happen before. And we so hope that this will continue on for other needs that are identified in our county and our community, and we can help fill those needs. Alan has a favorite, I'll let him tell you his question that he's asked, that we've asked ourselves, and
one of my concerns is the fact that the federal budget is a disaster. And at some point in time, they're going to have to look at reducing spending. And most of the federal government spending goes to help individuals in one form or another. And so the question that I've asked myself is, when it gets to the point where we say, no, it's not the government, then whose role is it? Do we just allow people to fend for themselves, or do other organizations and individuals step forward? And to me, that's a perfect role for people of faith. Whether they're doing it one-on-one through as they meet people, or whether they're doing it through their church, or whether they're doing it through other organizations where people of faith have come together. So we don't want to imply that there aren't many other organizations in the community where people of faith have come together. And we have food banks, we have other things. Churches offer free meals for those people that don't. But we see that this is one more example of how people of faith can come together and say, it's our job. Jesus has challenged us to be the ones to reach out to others, not to just pay our taxes and expect the government to do it.
Exactly, and that's one of the things that I want to express even further, is that the churches are working together with the food, they're working together with social services, they're working together with the medical missions, and I've heard brainstorming ideas that are coming together even further along here in 2012. And it's like it said, depending on where you live, you don't see this happen. And I realize the phrase body of Christ is actually being implemented right here in Ross County. We are trying to literally be the hands and feet from a medical perspective, to feeding them, to clothing them, the homeless, so on and so forth. There's a lot of needs right here in Ross County, and it's the same needs all across America. I hope that listeners that are interested in assisting what's happening here in Ross County will get on board. We'll go to hopeclinicfree.org or email them at hopeclinicfree@gmail.com. It's from 6 to 8 p.m. on Mondays at the Health Department at 475 Western Avenue, Suite 1A. And for those of you that are in the medical field or own a business, or maybe, you're retired, or maybe you're not and you just want to volunteer, or maybe you're one of those that can financially assist, go ahead and listen to that little, as I call, voice in the back of your head. Go ahead and do it. For those of you who end up listening to this program and tell me, I don't live in Ohio, I don't feel that I should do this in Ohio, what's happening right in your own backyard? How could you get something like this started where you live? So I'd like to thank you guys for coming today. It's been an amazing day. It's just a wonderful thing to see that's happening. People are getting help, medical missions, right here in Ross County. Thank you very much.
We'd like to thank you for the opportunity to share, and both what we're doing, but also the fact that God's been important in our lives, and it's time for us to now reach out to.
I would just like to also mention, in the community part of it, we had a Chillicothe's Runners Club that called and asked if we would like to have the proceeds from their run this year. And so that was the Muddy Leprechaun Race, which took place on St. Patrick's Day. And that organization donated $3,000 to us. Coming up, April 14th, which I think is going to be a very exciting event, is a community choir. And it is about 75 voices that are made up from people from many, many churches. And their theme this year is Hope Through the Sun, S-O-N. And they have asked to donate their proceeds to us also. So this is a concert where I'm sure you can buy tickets ahead of time, or you can buy them at the door. But I think this will be a very, very awesome night of praise for the Lord. I also would like to say one thing about outcomes at the clinic. We have all the numbers, all the people who have been served, the people who go into the prayer teams, go into the social service teams. We're looking at quality. But I can tell you that the most amazing outcome that we have had so far is that we have had someone accept the Lord in the prayer team, with the prayer team at our clinic this month. And to us, that's a real success.
You're exactly right. When we were able to serve people and meet a need, and then go even further and meet their soul, you can't get any better than that. You know, it goes to show you that what's happening here with the Hope Clinic is a real life transformation.
We call it loving God, loving people.
And with that, we'll close. Thank you very much.
Thank you.